This week's question is an interesting one. It's about unrecognized deficiency of vitamin B12. And this question comes from a gentleman who was experiencing some unusual symptoms. He had some weakness, some dizziness, and actually had some fainting spells, and was really unclear what was going on. The various side effects were attributed to the treatment, and the adjustments were made thinking that if there were some dosage changes, perhaps these symptoms would go away. But when the symptoms persisted, this gentleman was referred to a neurologist who immediately checked and said, "Oh my goodness, maybe what you have is a deficiency of vitamin B12. And lo and behold, that was the problem. And with vitamin B12 replacement shots, this gentleman got better very rapidly. And so this is a very important story, not just for this gentleman who was thrilled to be suddenly better with the vitamin B12 shots, but just for every myeloma patient to be aware that symptoms and problems that emerge during treatment are not necessarily due to the myeloma or to the treatment. There are many things that can emerge during treatment. And the better that myeloma patients are doing and the longer that patients are staying in remission and doing well, there is an opportunity that other medical issues could emerge, not due to the myeloma. And so this is important for the patient to be aware of and to be aware to discuss with the doctor. So what are some examples of these kinds of things? The deficiency of vitamin B12 experienced by this gentleman is relatively rare, but other kinds of things that can happen more commonly include low thyroid hormone, low folic acid or iron. These can be rather common. Also, a low magnesium level in the blood can occur. And so there are a variety of abnormalities of chemicals, hormones, vitamins that can occur and create symptoms and signs that could be problematic. And so this is a very important aspect to be aware of. So something to talk to the doctor about, and just to trigger the idea that maybe these things are not due to the myeloma or the treatment, and to be aware to maybe check what are the levels of the chemicals like magnesium or iron, and maybe some hormone levels are high or low, or maybe the blood sugar is high. This is another thing that can cause a variety of symptoms. And so this is a very key point for patients to be alert to. Look for other issues that could be causing the symptoms and may be easily correctable. So a very, very important point from our questioner this week.